Good morning, ma'am. I am Melowin Macabagbag, student nurse from Medical Colleges of Northern Philippines. Your nurse for today. May I know your name, ma'am?
My name is Duaydemir S. Soriano.
So today, ma'am, I will be assessing your eyes, ears, nose, and your mouth in order for me to know if there are some abnormalities. So shall we start, ma'am?
Yes, ma'am.
So now I am going to inspect the patient's eyebrow. So the patient's eyebrow seems to be symmetrical on the left and the right side. So can I touch it, ma'am?
Yes, ma'am.
So the distribution of the hair seems to be even and normal on the left and on the right side. So the patient's eyebrows are evenly distributed both on the left and the right side. Both are symmetrical. So ma'am, can I touch your face again?
Yes, ma'am.
So the patient's eyelid seems to be symmetrical also, both left and the right side. So ma'am, could you please close your eyes tightly, then open them up? Okay, so the patients had no trouble opening and closing the eye. The eyelids are covering the part of the sclera, which is normal. Now I am going to continue to assess the patient's palpebral conjunctiva. So ma'am, could you please look down for me? So now for the sclera and cornea of the patients. Patient's sclera looks perfectly normal both on the left and the right side, and there are no abnormalities with the patient's cornea both on the left side and the right side. No sclera and cornea are normal. I'm gonna assess. The patient's iris is dark brown in color. Both of iris are of the same size. Now, I am going to check the construction of the patient's pupils. So, I've dimmed the light. So, ma'am, I'm gonna check your eye again. So, I'm just gonna shine a light on your eyes. It okay with you?
Yes, ma'am.
So, ma'am, I want you to look at the object right there. So, just look at there po for the moment. I'm gonna start. So, the pupils are constricting both left and the right side. Pupils are constricting and it should normal. So, ma'am, I just want you to look at my finger and I shine a light po. Both pupils on the left and the right are still constricting. So what I'm gonna do, I'm going to show my fingers on the side while on one side of your eye is covered. So you are going to tell me how many you see. So let's start, ma'am. Cover your left eye po for me.
1, 2, 1.
Okay, ma'am. Can you please blink for me? Okay, the other side po.
1, 2, 1.
Okay, can you blink for me, ma'am? so the patient can identify how many fingers there are. So now I am going to assess the patient's nose. So patient's nose is in the midline of the face or midline. There are seem to be no deviation to the left or to the right. Septum is normal, both nostrils and normal. So now we're going to occlude one side of your nostril. So you occlude it for me like this, ma'am. So inhale, exhale. Okay. Did you have a hard time breathing, ma'am? And now for the other side, po. Inhale, exhale. Okay po. Did you have a hard time breathing po? So the patient can breathe perfectly normal. Even if one side is occluded, so there's no obstruction in the nose. So now we're going to palpate the patient's external nostrils or nails. So now I am going to assess the patient's ear. So I'm just going to see if your ears are leveled to the side of your eyes. So the patient's pin of the ear is almost at the level of the patient's eye. So now we're going to palpate for the patient's cartilage and mastoid process. So ma'am, I'm gonna touch your face again. Is it okay?
Yes, ma'am.
Do you feel any pain, ma'am? There seems to be no swelling with the cartilage. Okay, now to the mastoid process. Do you feel any pain, ma'am?
None, ma'am.
Any tenderness po?
Wala po.
There are no swelling and no masses. So, cartilage and mastoid process is normal. So, now we're going to assess the patient's ear canal and tympanic membrane. And I'm going to touch your ear po.
Go.
So, the patient's ear canal is same with the color of ear and there are no presence of foreign bodies. There is cerumen or wax which is totally normal for the patient. So now I am going to check the patient's mouth and the lips. Can I touch your face, ma'am?
Yes, ma'am.
So the patient's lips are symmetrical both left and the right side. There's no lesions, no bleeding, no edema or any problem with the lips.
Go.
So can I touch again your lips, ma'am?
Yes, ma'am.
So the patient's lip is soft and smooth.
Go.
So now I am going to check the teeth of the patients. Ma'am, could you please smile for me? Could you please open your mouth po? So there are 25 teeth, which is normal for a 17 years old girl. Her teeth dominant color of the teeth is white and there is no malocclusion. Could you please stick out your tongue, ma'am?
Go.
So, I'm gonna touch your tongue, ma'am. Do you feel anything? There seem to be no swelling, no pain, and no presence of exudate, and the tongue is in the midline. It is not deviating to the left or right side.
Go.
Now, I am going to proceed to patient's uvula along with it. So, I'm gonna touch your tongue, ma'am. Do you feel anything?
None.
There seem to be no swelling, no pain, or no presence of exudate, and to the tongue is in the midline. It is not deviating to the left or the right side. So now we're going to proceed to the patient's uvula. Along with it, of course, is the soft palate. So, ma'am, could you please say for me?
Ah.
So, I want you to say like really long po, ma'am.
Ah.
So, the patient uvula is vibrating or moving as she says, which is totally normal, and it is pinkish color. The tonsils are perfectly normal. It is around 2.5 centimeters. Then is no swelling and no. So, ma'am, we are done. Thank you so much po. I have seen all your normalities with your eyes, ears, nose, and your mouth po.
Yes, ma'am. Thank you din po.